Stephanie, thank you so much for joining us as my resident. And I think, oh, and there's Dr. Claudia, one of my faculty is joining. She has a little one that I'm hoping will make a appearance, and Stephanie's kids might make an appearance depending on where she's at.
No, I'm hiding in a room.
You're hiding them. Okay. Welcome so much. My name is Dr. Kathy Sweeney, and I am one of the associate directors of the family medicine residency. I also direct the transitional year residency, and I'm the director of osteopathic education, and I am someone that loves FMEC. Hello, Dr. Claudia.
Hi, sorry, it took me a second to log on.
Good. We go to Family Medicine Educational Consortium every year, and I have so much fun. I hope most of you are coming. Raise your hand if you're coming to FMEC this year. Yay! Yay! And if you aren't coming and would like to come, maybe send Scott a message or me a message afterwards, because probably things can still happen, Scott, for students to come, don't you think?
We're at 311, but we're having a couple drop out, so we might have some room.
So if anybody wants to come, let us know, because it's a lot of fun. We have an osteopathic track, and then we have millions of other things going on. They have great keynote speakers, but so he might have someone drop in and you could drop into their slot because they provide housing and food. You just have to get your body there. So you might think, well, why did I pick this for Hot Topics? Well, I'm from Altoona, Pennsylvania. I practiced in State College for 3 years prior to joining the residency, and I did full scope family medicine, was in the nursery seeing babies in the ICU, admitting my own patients, and had my own practice. And when I came to the residency, I was married a few years, ready to start a family. And I just reflected on a lot of the challenges that I found. Now, I'm a lot older. I'm a lot older than most of you. So we're going back to like the 1980s, okay? But in the experiences I had in med school were like this. Out of 210 students in my PCOM class, there were less than 30 women. Now think about that compared to today. Now most med schools are at least half women. We were like really looking for role models. I remember we had one professor. There used to be a med school that I worked at Philadelphia one summer when I was in college called the Women's Medical. It's not there anymore. It's kind of blended into Drexel. Drexel absorbed Hahnemann and Women's Medical. But at Women's Medical, one of our endocrine lecturers came over to Philadelphia College of Osteopathic Medicine, and she was a woman with 5 children. And I remember just sitting there thinking, how'd she pull that off? You know, it was just like, how'd she do that? And I found out she had a live-in nanny pretty much to help her because her husband worked also. But, you know, we listened so carefully to every tidbit anybody could give us about how things were done. Thank you, Dr. Nowicki, for coming. Looks like Alex is still at work somewhere, but he's tuning in. Appreciate it. And all these incidences just were challenges I saw women go through, and we have same challenges, but different challenges today. Some of the things that might surprise you all is like when I was an intern, and this would be 1985 in Dayton, Ohio, there were 30 interns. There were 2 women in the class, and one of the family medicine people got pregnant and had a baby. It was like virgin birth. People were like, oh. Same thing in med school. There was one woman that had a baby, and everybody, we had this huge, we stopped class to announce when she went into the hospital in labor, and we had a big class-wide baby shower because it was such a big deal. Oh, one girl in the class is having a baby, because it was hard to do those things because it was kind of looked at like, what are you, I don't know. It was just not as welcoming. So anyway, with all that, I've been really happy to see a lot of changes come for women and men. Our men residents, when they become fathers, they take paternity leaves. One of our seniors, he really worked it. He had a paternity leave when he was with us, and now he's a hospitalist. And he just told me, Dr. Sweeney, I got another week paternity leave. So I think he's been home with his baby for like 5 weeks, which we're very happy about. So things are better for families. And I don't want to, you'll have to forgive me in this day of, you know, genders and things. I'm just going to stick pretty much with women and men, because I don't know if I can know how to do the whole conversation and cover everything, but I know that we have some couples that are same sex and all those sorts of things, but still the same family issues come up. So I think that is all kind of where I came from for having this, because we still have lots of challenges to balance our work life and our home life. I don't really think balance is the right word. I think it's more like we do certain things more at some times and other things more at another time, and we try to just make it work. Our hospital is in a small town of about 60,000, 120 in our county. We have about 350 beds. We have, ICU, we have medical ICU, surgical ICU, neuro ICU, very busy ER, and only family medicine. And I have 4 transitional year residents. So it gives you an idea who all we are. And we teach our residents everything from ICU care to maternity care to procedures and everything in between. So that being said, I'm going to have each of my residents, and since there's a small group of us, I only see like a small group on the screen. I'd like everybody to do a one-liner. If you ever listen to Curbsider's medical podcast, they have their guests do a one-liner to kind of say something personal and something professional. So I'll start. I'm Dr. Sweeney. I love osteopathic manual therapy. I love teaching residents. And I like to swim and do Pilates and ski. So I'm going to let Alex go next because he's very exciting. He does all kinds of fun things. He has more fun than anyone. I mean, I followed him on Facebook and I'm intensely jealous. And like sometimes, like when he goes places local, I go after because I know it'll be super fun. So Alex, what would your one-liner be?
Dr. Sweeney, I'm not that fun.
Oh, you are so fun.
All right. My name is Alex. I'm one of the third years here. I was born and raised in the Philippines, but I like to go snowboarding during winter. And then I like to do summertime. I like to go to the beach and go fishing.
And he caught this huge fish this year. How big was that thing?
It was like 30 inches. It was a striped bass in New Jersey.
And he loves to travel. That's what I love to look at all the places he goes. Well, thank you for joining us, Alex.
Of course.
And then I'll have Stephanie. What would you like to share? Stephanie's one of our new PGY1 family medicine residents.
Absolutely. Hi, guys. My name is Stephanie Tuxbury. I was born and raised in Cameroon. That, for those who don't know, that's the western part of Africa. The equator just passes right in the middle of the country. I was actually
she froze it. It was
raising.
I think Stephanie, you froze. Well, we'll come back to Stephanie. And I was so excited because I wanted to hear more about that. So we'll get back to Stephanie when she unfreezes. Dr. Kadia, now I hope you're going to share your bundle of joy for at least a little bit and let everybody admire him. But what would you like your one-liner to be?
Yeah, he's actually taking a nap right now, but he'll wake up soon.
Yeah.
So my name is Kathy Kadia. I'm one of the faculty at UPMC Altoona. Professionally, I really do enjoy teaching residents, but I really enjoy teaching procedures. I just taught a couple in office today and just got home from there. Personally, I really do enjoy traveling and spending time with my family, especially my little one now. So hopefully I can bring him on once he wakes up.
If he wakes up, yeah.
Yeah.
And Dr. Cuddy is planning a dermatology workshop for all our residents in September. And we have procedure workshops planned every month all through the year. So I really appreciate it. I kind of delegated to her to get it together and she's doing a fantastic job. Who else do we have on of mine? I don't want to neglect anybody. I wanted to give the poor students a little chance to like see what we're doing because I know it's a little shy when you don't know people. But Alexa, what would you want us to know about you?
Hi, so I'm Alexa. I'm a fourth-year medical student at LECOM in Erie, PA.
Nice.
And I guess in high school, I danced ballet, and then I did dance a little bit in college, but now I
That's really
just enjoy
cool.
taking
We
like
have a
online
lot of
workout
students that come
classes.
from LECOM. I hope we get to see you, Alexa.
Yeah.
Sandra, do you want to go next?
Sure. I'm a fourth year at Liberty University College of Osteopathic Medicine in Virginia.
Nice.
And I enjoy it. I haven't been able to do it since starting medical school, but I am a second degree black belt in Taekwondo and do enjoy martial arts.
That's great. What a great skill. My kids took that. It's just really cool. I don't know how to do it, but it is really neat. Now, and so Yeme, is that right? Yemi, do you want to go?
Yes, that's right. So I'm Yemi Olaniro. I'm actually born and raised in Nigeria. That's West Africa, like Stephanie as well. I have graduated from medical school because I trained in Nigeria before I relocated to the United States. I love working with the underserved population, perhaps because I grew up in such a setting. So I love primary care, screening, healthcare that way. Personally, yes, I love spending time with my family. I love to read, but more now I say I love to listen because I now listen to a lot of audiobooks as part of my work. And I also love to travel.
Very nice. Well, if it keeps a small group, we can all go and then I'll get you some questions. I want you to kind of think, because I have all kinds of questions I can do for discussion, but I want you to feel like you can pick Dr. Claudia's brain, my brain, Stephanie's brain, Alex's brain about anything about work-life balance, women in medicine. Raphael, what would you like us to know about you?
Well, thank you, Dr. Trini, and everyone here. Nice to join you in this evening. My name is Rafael Jimenez. I'm coming from Dominican Republic.
Nice.
Land of many baseball players. So I'm doing now primary care, working on OB/GYN hospital, assisting in screening for cervical cancer and breast cancer screening tests, and interested in knowing more about your program and how the program involves in OB/GYN procedures.
Good, yeah. In fact, one of our faculty, Dr. Grant Phillips, is going to the Dominican Republic on a mission trip in a couple weeks. Alex, are you going with him? I think so. You and Lizzie? I forget who's going.
No, I think it's Alexandra.
Alexandra's going.
Yes.
He goes every year to the Dominican Republic. But yeah, we do a lot of women's health. I teach a colposcopy course for the residents, and we teach endometrial biopsies and Nexplanons and endometrial biopsies. So yeah, we do a lot of that. And then of course, Dr. Claudia can tell you later about obstetrics curriculum. She's one of our faculty at UOB. So that's great. And then we'll have Amanda and Marie, and then I'm going to ask some questions to get the discussion going. Amanda, what would you like to share?
Hi, I'm Amanda. I'm a fourth year from NYITCOM. I was born in Columbia, but raised in Buffalo, New York. And I'm interested in preventative health and global health. So that's really great that you guys do mission trips.
Yes.
And I guess fun facts about me, I have 2 cats. You might see them in the background. And I love Pelotoning. So
what was the last thing you loved?
I love to Peloton.
Oh, wow. That's cool. Yeah, Alex and Lizzie just came back. Why don't you tell them a one-liner about the trip that you went on with Dr. Rice?
Yeah, so we went to Guatemala pretty recently. We went there for, I think 6 days actually. So we had 4 days of clinic, and we basically established with the physician there. And then we brought some medications, some supplies, and we basically announced it to everybody in that area. We went through we actually announced it through the radio, said like it's free, we got free medications, we got free antibiotics, and you get free free visits basically. So yeah,
they had some beautiful pictures, because Alex also did that zip lining over the most beautiful lake I've ever seen.
It was called Lake Atitlan.
It was
beautiful. A very, very big lake with 3 volcanoes actually right next to it.
So it was amazing.
Yeah.
Dr. Rice has talked me and my husband into going next time you guys go. Now, Marie, why don't you introduce yourself if you wish, or you can pass, whatever you like.
Sure, that's fine. Hello everyone. My name is Marie Bove. I'm a third-year medical student at Cooper Medical School in Camden, New Jersey. And in terms of what I like to do, my sister just gave birth not too long ago, so I've been enjoying spending time with my new niece. Love spending time with family, and I love just watching TV like Netflix, Hulu, and all that stuff.
Okay, great. Well, let's get started with our discussion. We're going to get moving. I did think it was nice to know everybody. I see there's quite a lot of osteopathic students on the call. I will tell you that our osteopathic curriculum is really an exciting part of our program. We teach our MDs also how to do OMT. Next week, I'm teaching MDs how to treat low back pain. I'm doing it both for our residents with my residents helping me teach our MD residents. Stephanie will be getting that next week, and Alex, who's had it a lot of times. And then we're going to go to FMEC, and I'll be in the osteopathic track pretty much both 2 days, and we'll have a lot of OMT down at FMEC. But we can talk about any questions you have about our OMT curriculum later, but essentially it's very hands-on, very practical. We teach you things you really can use in the family medicine office. I think Alex, my MD resident, did OMT when he was on the mission trip, didn't you?
Yeah, I actually did a lot of OMT, especially like occipital release for headaches. And yeah, it was very neat experience actually. And yeah.
Yeah, and he is an MD, but he has picked up some things, and mission trips and global health OMT is really handy because you always have your hands to help people. You know, it's not like you need extra materials. So, okay, so I'm going to throw out a question. Let's see what I'm going to start with. I guess what I'll start with is, you know, from maybe our faculty and residents, what is the biggest, because I know Stephanie and Dr. Kadia and Dr. Tuxbury are juggling kids and work. And so Stephanie's at the resident stage of starting. Dr. Kadia has been a faculty for a few years. Can you just talk about what do you think the biggest challenges and also the biggest joys of doing that are? And maybe whoever wants to go first.
I can go first. For me, I think just having started residency is really, for me, it's really important having my family here. My two kids they're actually a great support system for me. So when I get home from a long day of work, it's actually great seeing them smiling, coming at me. So I don't see it as a detriment per se, but I see actually as a really great mental health. You know, I come home and that's my space, and I see my kids and I get to enjoy them. Of course, there is some downside to it. It's a lot difficult because you still have to, you know, pay attention to him and really help him out and developmental wise. It's not really a downside, but I think it's something you have to keep in mind, you know, having to still be present all the time as a mother when you spend 12 hours in the hospital and you come home. So I think that has been really helpful. I think having started residency 3-4 months ago, I think I'm more of a better mother because these are things that I pay attention to when I get home. I'm like, my kids haven't had 10 minutes with me. I need to sit down and read them for 10 minutes. Before starting residency, I wasn't really paying attention to these things because, you know what, I was always around, or, you know, I had a lot more time with them. But because time is so limited now, I do pay attention more.
Absolutely.
I think it helps me as a mother. It also helps them.
Yeah, I always tell male and female residents, whether they have kids or whether they have spouses or whoever is in their family unit, that the first thing you should do when you get home is utter attention to kids, spouse, whatever. Because if you don't give full attention, people will be asking you for things when later at 9 p.m. when you got to study or something. So I always say full attention for 2 hours. And you're right, you do really tune into your kids because you haven't been there all day. And I think that's a big trick. Some people try to still be distracted, but it's important to just get into that mom mode because they'll be going to bed soon enough, hopefully.
Yeah, just like before coming to the meeting now, we just came back from the YMCA. I'm teaching my husband actually teaching how to swim. So it was a time as a family together for like 25 minutes before dinner time. So that these are little things that I don't take for granted anymore.
Right.
That I used to, so.
Yeah, I love our Y. Stephanie and I both live within about 5 minutes of the Y.
Yeah.
And, it's a great place to swim, work out, do all kinds of things.
Yeah.
Well, Dr. Kadi, I'm really looking forward to hearing your thoughts because you're a new mom. And you've
brand new. So I just had my baby in January and I came back to work in June. So I'm still navigating all the different challenges of being a full-time physician as well as a full-time mom. But I will say that yes, absolutely, there's challenges, but it's quite rewarding too at the same time. So I think one of the biggest challenges I've seen, and I think it's mostly with call, is that the unpredictability of call and having to run off, especially with OB, but that's really it that I've noticed. Otherwise, my schedule is fairly steady. I work 8 to 5 most days and come home. So I definitely look forward to coming home. It's probably one of the most exciting parts of my day, and just seeing him, just smiling, just picking him up, and just playing with him. I think that's probably the most exciting. The challenges for me right now, and these may just apply to me right now, are the pumping. I'm breastfeeding him, so the pumping, finding the time to pump. But our program is very, very extremely breastfeeding friendly. We actually have a lactation room, fridge dedicated to it, pumping station, microwave just for sterilization. So everything's geared towards moms who are breastfeeding. So that is there. It's just finding the time to do it. And our faculty are very supportive. I've called on Dr. Sweeney a few times to come and help me cover some stuff while I go pump, and many other faculty. So I think those are my challenges, is just finding the time in my day to fit in the pumping, the breastfeeding part, coming home, and just being there and so things like that. But otherwise, it's like any other job. I work 8 to 5, come home, and I'm present, I'm here. So really my only thing is kind of just breastfeeding.
And she's doing a great job with it. She's doing a great job with it. Last year in the residency, I think at graduation, we had about 5 babies at graduation. We had a lot of kids. It was a good baby year.
We did have a lot. And I think, again, like being a woman in medicine, just finding that support system with all of, like, I was not surprised that our program was so breastfeeding friendly, because I'd been working here for almost 3 years before I had the baby. But the fact that, all I had to say was I need to go pump, and so many of my colleagues would just come and relieve me, and that goes for the residents as well. So I think that's very important if you guys are choosing that. And the other thing is just everyone really understanding that you have a lot going on as a new parent, whether that's at work or at home, and that support is really important and encouraging too. Even if you are at work from 8 to 5 or 8:30 to 5:30, just the fact that Dr. Sweeney will check in on me, our program director, Dr. Beckstead, will come and check in sometimes and say, hey, so the kid's good, how's everything at home? And that in itself is a big support system that we have. Even the residents, like Alex himself and Lizzie and all these people, will be checking in to see, hey, so I haven't seen you in a few days, how's the baby, how are you? And so I think that is important for women to get that in their workplace.
Yeah, I think that's one of the thing about our program, that we're all very close, and really do support each other, and check in with each other if we hear somebody's sick. That it just makes for a nice work atmosphere. One thing I did in preparation for this talk is I listened to a really nice Curbsiders on, I think it was on women in medicine. And one of the pieces of advice that they gave, and I really think it's a good one, is that life will happen in residency. Life will happen. Kids will get sick, grandparents die, things happen. There's family crises. And when you find your program, find a program director who's approachable. And Dr. Beckstead is as approachable as anybody gets. He's our program director. He's not on tonight because he said, Kathy, you planned it for a night I couldn't come, because he usually comes to this, but he is very understanding and that can help you with hard decisions and takes well-being of residents seriously. And Dr. Beckstead was really on the cutting edge of this whole well-being thing years ago. And we do a lot of things for well-being. We have a behavioral scientist that does a resident support group every month. Our chief resident does resiliency rounds. And I'm going to let Alex answer this, but I think perhaps the biggest wellness is that our residents do a lot of things together and hang out. What do you think, Alex?
Yeah, so the biggest thing for the residents is like, we actually hang out pretty frequently. So we're actually good friends with each other. Like sometimes last year we did a lot of like winter time. We would go to Blue Knob here, which is like 20 minutes, 30 minutes away from here. And then we had a group of residents actually that went snowboarding and skiing at the same time. One of the residents, I actually taught her how to snowboard. So she's very good at it now. And then there's a lake here too, Canoe Creek. And we go there, we go kayaking from time to time as well there. We go hiking all the time. So, I mean, it's residency, you're busy, but you still have time to kind of just relax, decompress, and hang out with the people that you actually see like every day, basically. So, so if you're really into that, a lot of outdoorsy stuff, a lot of, explore and all that stuff. There's a lot of things that you can do here.
Well, even Alex and Lizzie went to Trough Creek Park, which I had never been to. And when I saw the pictures they had, I went. It was lovely. It's down by Lake Raystown, which is kind of like a motorboat lake.
And I think Roshan was with us too as well.
Oh, was she? Yeah. That was a beautiful. That's a beautiful park. It's like all carved into rocks. It's so cool. But we have a little cabin, and during COVID, we didn't get to do as much visiting with the residents as we wanted to. But this year, we'll be doing that, Alex. I was like talking to the residents in the parking lot. We tried to be whatever we were supposed to be doing, but I think by now we'll just be able to come up to the cabin and enjoy, because that's the reason we have it, is to have friends and family come on in.
Yes, looking forward for that.
Yeah. So here's another question. Let's see a question. Maybe I can do this one for Stephanie. What would you say, whether you're a male or a female, what makes a great partner for a person in medicine? If you were advising these young people, if they haven't found a life partner yet, what should they be looking for?
This is a tricky one because I've been married for 12 years. So my husband is not a physician, and I think that's helping me a lot. Because when I get home, I check out. He's a business guy. So I think someone who is actually understanding. Absolutely. The person can't judge. The person really has to understand your career and being there 100% for you. And I think that's what my husband has done absolutely beautifully. And also another thing is he does not differentiate between sexes. Oh, you're the woman, you're supposed to be doing all these chores. No, the work at home, he actually does 90% work at home than I do. I do 10% because I'm so busy, and he understands I'm busy. So he does diaper changes, he does all the dishes at home. So he doesn't really, and that's what you really are looking for in a partner, especially when you're a woman in medicine. You want that partner that actually understands you may not be there for 12 hours. You have to change diapers. You have to do all the chores. You have to go to Walmart and buy groceries for the week. So I think if I have to, you know, advise any young person out there who's really interested in medicine and who's looking for a partner, is to really look for that one person who understands that you are in really a career. This is not a job. This is your lifestyle. So
yeah, I think that's really good advice, Stephanie. You know, you really want to communicate real well. Like that's one thing that, you know, I tell people like at orientation is, you know, whether it's your mom, your dad, your friends, your spouse, you need to communicate with them what's kind of involved, because if they're not in medicine, they might not understand that you may not get a breather to even send a text during the day. Some days you can, some days you can't. And that, you know, you do have some studying you have to do at night. So it's really important to have someone you can communicate and that you can have realistic discussions with.
Absolutely.
And you know, my husband's retired now. I don't cook, I don't clean, I don't shop, I don't do any of that stuff because, you know, he's home, so he takes care of it. But even when we had the kids, like once I had Mike and I had to go home and breastfeed, just like Dr. Claudia is, he figured out if he was going to eat, he was going to have to learn how to cook.
Absolutely.
So that was very educational for him because he likes to eat. So, you know, I think it's really that communicating, and your roles kind of flow and change depending on what's going on. Dr. Claudia, you have a lovely husband. What would you comment about the whole, you know, communication with partner and all that sort of thing?
Yeah, no, you're right. I do. So my husband's a pharmacist, and he went to professional school, so to majority extent he understands my career, my dedication towards medicine. He actually is probably more supportive of it than I myself am sometimes. You know, he'll I remember in residency, if I had notes to do and I would mention that, God forbid I mention it, he would make me sit down and do my notes like a little child and until I'm done. But now obviously we're past that. And as an attending, it's just works itself into our routine so beautifully that he knows the nights that I'm on call, and he'll check in on me around 4 o'clock and see if I'm going to be stuck at the hospital, and see if he needs to drop off food for me, or if I am going to actually be able to come home and eat dinner. So he's figured out, he's a great cook. He always was a great cook. So he always knew how to cook and wants to cook. But even if if he's busy at work and he hasn't been able to cook, he will pick up something, drop it off. And now with the baby in the picture, he is on a paternity leave right now, which really helps us out because he is home 24/7 to take care of the baby. So that's nice. But I think even when he is at work, he does work from home, which is nice. But just having those roles that today's my busy day and today's your busy day, and just understanding that my day cannot always be the busy one and his day cannot always be the easier one. That really has worked well for us. That, okay, there are some days where I'm really busy on my call nights, and he understands that very well, and he actually supports me, super supports me. Sometimes I'm like, you don't even need to come and drop off food for me, I'll just buy something here, but he comes and drops off food for me anyway. Or there are nights where he's busy because he works for the Food and Drug Administration, so he'll push out stuff after hours, and those nights I kind of take over and do stuff around the house and take care of things while he does his work stuff, which is kind of like my on-call stuff. So I think just knowing that given both of us are in very super competitive careers, that he has busy days and I have busy days has helped us a lot.
Thank you, Randy. Bye-bye.
Just navigating those basically for us. I think that's worked well.
Well, that's great. I think that the next thing, I'm sorry, I had to answer that. My car has a little problem that needed to get fixed. And I saw my husband's phone go, so excuse me for having to take that. Because my husband listened to me. I said, I have an important Zoom meeting, honey. You can't, he got the dishes done real quick and left. So anyway, he listened to me and I had to get the phone. I think one of the things I tell the residents too, and this goes for all sexes and everybody, is outsource anything that, oh, we've got a visitor. There he is.
There he is. He just woke up. Say hi, Bubba. Say hi.
How are you? He's so cute. We'll feast on his cuteness as we're talking. But you know, one of the things, and I got distracted by cuteness. But one of the things I think I tell my residents, well, at orientation, is to outsource anything that doesn't make you really happy. You know, so I always say that probably my kids aren't going to, like, you know, at my bedside when I'm passing on to the next life, say, boy, my mom cleaned a toilet like nobody else. So, you know, when I had the little kids in the house, now my husband cleans, but then I had some help with cleaning. I had a babysitter that came to the house because I wanted to be able to get to the hospital early and, you know, stay as long as I had to. So getting that extra help really counts. Well, it looks like my lifestyle medicine people have joined us, and I thank them. They've already done one lifestyle medicine meeting, and now they're joining us. We've got Dr. Megan Maurer, and I'll let her introduce herself in a second. And we have Alexandra Spirou, another one of our senior residents who was at the lifestyle medicine meeting. Dr. Maurer, why don't you give us a one-line introduction about you as a person, and then tell us a little bit about lifestyle medicine at our residency.
So I'm Megan Maurer. I'm one of the faculty at AFP. I'm also a mom of 4 kids, 7 and under, so I'm a pretty busy person. And I'm also head of our lifestyle medicine curriculum at AFP. And for those of you who don't know what lifestyle medicine is, it's basically using plant predominant diets and physical activity and basically, you know, lifestyle modifications to treat and prevent disease. And so we started our curriculum last year and have an increasing number of residents doing the curriculum. And when they graduate, will be able to sit for the exam and become board certified. And we're pretty excited about that. So.
Yeah, and I think they ordered dinner for themselves tonight. I hope you ate a plant-based meal.
We got Chipotle. It was very good.
Okay, very good, because I said order it. Alexandra, what would you like to share in one-liner? She has many talents. This woman is a very talented woman. What would you have be a one-liner? Then I'll ask you some other kind of question.
Oh, one-liner. Yeah, so I'm Alexandra Spirou. I'm a second-year family medicine resident at UPMC Altoona. I'm also Canadian. I'm from Windsor, Ontario. And yeah, I love being a family medicine resident. It's been really enjoyable so far. And I'm happy to be here tonight too.
Well, here, I'll ask you a question, Alexandra.
Okay.
When they're looking at a residency, and just answer this in general, how could they pick a residency that you think they would thrive in?
That's a good question. How would they pick a residency that they think they would thrive in? I mean, for me, like I was lucky enough to meet some of the faculty and current residents the year before I applied at an in-person conference, like right before COVID. I got really lucky. And so I think really, if you have the chance to see your program in person, like after interviews, I would definitely do that, because you get a lot kind of an idea of if you're going to thrive in a program by if you get along with the people that you would be working with. And that was really it for me, that I just loved all of the faculty and the residents that I got to know even prior to my interview and then during the interview process, and kind of seeing if goals that you would have for your career, let's say you're interested in OB and, you know, within family medicine, seeing if that program can help you, you know, achieve that goal. And yeah, I think looking at those things, like looking at the people and looking at what you want to accomplish and if they can help get you there.
That's a really good answer, Alexandra. And I just threw that at her. No prep. I did send them some notes, but she's had no time to look at it. I kind of tried to send them an agenda. But you know, that's the nice thing about Family Medicine Educational Consortium and these kind of get-togethers. I'm hoping that when we go to the meeting, and Dr. Maurer is going to the meeting with me, some of the other residents are going, Dr. Beckstead will be there, Dr. Fabina, I think Dr. Na and Dr. Braddock are all going. If I've forgotten anybody, forgive me. But we're all going to, it looks like we have some Tuxberries joining us too. More cute people.
Say hi, Avery.
Hi.
Hi, honey.
Hey, that's my son, Avery.
Oh my gosh. Hi, Avery. How are you? Did you go swimming?
Did you go swimming?
Yeah.
So that was one of our swimmers. Very good. One of our residents last year, Nora, took her baby to the Y for Baby swimming on Saturday mornings. I'd see them there. Forget where I was, but I think what I was talking about was like when we go to Family Medicine Educational Consortium, that's another one of those meetings where you'll get to meet lots of residencies face to face. And one of the things Alexandra pointed out is really important. We're going to do virtual interviews this year, but we are basically not requiring, but just praying that people will come and take us up on. We're going to have an Altoona exploration or something, explore Altoona, because we really believe that when you get to see our program face to face and see how everybody works together, you can really see whether it's a place you want to be. And most all the students, I'm the advisor for all the osteopathic students. Dr. Rule does most of the MD students, and our students have a wonderful time on rotation. And that's another thing to realize is 3rd and 4th years, you can come and do rotations with us, a month, 2 weeks, all sorts of formats for that, including our rural office, which Dr. Maurer is my osteopathic site director there. Can you tell us a few words about the rural office, Dr. Maurer?
So it's truly in a small town. I'd say, I'm not sure exactly how many people live in Williamsburg, but it's less than 1,000. It's truly small. We don't have any traffic lights. I mean, it's just a few stop signs, and we have a gas station and a convenience store. I mean, it's pretty small, and a lot of farms. And it's definitely a different environment than you know, a city or even in Altoona. You definitely get to take care of whole families and a lot of continuity of care. And I actually saw my patients as a resident here, and as a faculty here, I still know you know, the people who are coming here are the same people that I saw as a resident. You know, I'm giving away my age, but 10 years ago. And some of the patients that are coming here are you know, teenagers or now but I delivered them as babies. So that's kind of cool. So it's a really different, you know, feel to it.
That's the nice thing about our residency, because it's a small Pennsylvania town, Altoona is, we can kind of get our residents all sorts of experiences. They can choose to do their continuity patients with us in town, where I've been there longer than you'd like to count, over 30 years. And I have patients that have been with me the whole 30 years, people I've delivered and they've grown up and they've had kids. Or they can do their continuity out in the rural office, or all our residents get some time in the rural office. So one of the nice things about our program is, you know, you can kind of create things. In fact, we have a thing called an ICC where people can create an area of interest. Some people have done dermatology. Some people have done osteopathic manual medicine and women's health. I don't know, does anybody on the call, Alex or Alexandra, do you guys have an ICC? You don't, not everybody has to, it's just if they're interested. Right now I'm doing a women's health procedure ICC with Dr. Connolly, our chief. We've had all sorts of things, and those things, what we have you do is come up with some ideas, and then the faculty help you develop them. And it's not anything anybody has to do. You can learn everything you want to do to be a very good family doctor just going through the program, but we'd like to make things very individual. Another strength of our program, and I get asked this, is every program has things that have to, oh, we have another person joining us though from the Tuxbury household. Go ahead, let's introduce our another little one. What's up? Who's with you now?
Emma.
Hi, Emma.
Say hi. Say
hi. Hello. Thank you for coming to our meeting. Another strength of our program is everybody says they have, you know, they ask me the question, what are your strengths and weaknesses and what are your problems? I go, every day, if you're a human being, there's things you need to improve on. The cool thing is that our program, our chief resident goes to faculty meeting every week, and Dr. Beckstead sits there and goes, okay, I'm ready for the chief resident report. And whatever the residents have on their minds, they share, and then we work together for solutions. And I think that's the cool thing, that open communication and that problem solving that goes on between the residents and the faculty. So let's see. I think now in the last 10 minutes, I think I've given you plenty of time to get comfortable with us. So students, throw out those questions. Is there anything you want to ask a family medicine faculty or resident? Because we are yours. And if you don't, I'll come up with something else, but just wanted to give you some time to ask us anything you were interested in. That's okay. Think about it.
Raphael, do you have a question?
Oh, yes, go ahead.
Well, I would want to know, besides women care and OB procedures, does the program offer some experience related to HIV care?
Do we have patients with HIV care? Is that the question, Raphael?
Yes, Dr. Sweeney.
Yes, I know Dr. Rule was just talking to me about one of his patients with HIV that he cares for with HIV. We don't have a huge population, but we have patients in our practice. There's an infectious disease doc in town that will help us. And if it's complicated, there's HIV docs at both Hershey and Pittsburgh that we utilize. But we have a pregnancy care recovery center. So we help women that have substance issues in the recovery center. And Dr. Kadia might be able to tell you more about that in a little bit. And then we also are starting an MAT program for patients in our regular office. Luckily, you know, we have some HIV patients. They're the ones that we know of are being treated, but we don't have a huge population. Like there's not a, but you can, I don't know how else to put it. We have patients in our practice, but it's not like, you know, you have hundreds of them, you know. Does that help, Raphael?
Yes, thank you, Dr. Sweeney.
Yeah, and Dr. Kadia, do you want to talk a little bit about the Pregnancy Care Recovery Center?
Yeah, so we provide medication-assisted therapy to our currently pregnant patient in what we call our Pregnancy Recovery Center, PRC office. And so there's 6 of us faculty who do OB, and each week, whoever is on, we see these patients on a weekly, bi-weekly basis, depending on what they need. So we prescribe the Subutex and see them, counsel them on any other drug use that they've had in the past, things like that. We do not have any HIV positive patients currently, but like Dr. Sweeney said, our practice in general does, but not the pregnant ones.
Well, thanks. I just thought that you could speak to that. I'm going to ask for any other student questions, and then I will get the conversation going if anybody doesn't have any. So I don't want to make you feel like you have to, but I want to give you that opportunity.
So I have a question.
Oh, yes, good. And then I think Sandra has one. Yes, Jamie.
So thank you for sharing so much about your program in this very informal way. I think you provided a lot of information. And so 2 questions. One is, do you have a structured mentoring program? And second question is, how about geriatric medicine? Do you have nursing home postings, and how do you go about, I mean, do you have a special curriculum, or it's just like
yes.
on the side?
Thank you. Well, for mentoring, we have both formal and informal. Every resident, when they come first year, and Stephanie and Alex can talk about this, or Alexandra, has a resident mentor. And I'm going to have one of them talk about that. Residents also have a faculty advisor, and that's official. And then I think what's kind of unique is we have an open door policy. Like Dr. Beckstead and I, it's really funny. Different residents will come to each of us for different kinds of issues, or other faculty member. Like people will just like, it doesn't have to be your advisor. Maybe you just know this person could help you with this or connect on this. And so people will just go to whatever faculty member they would like to talk to, and people are very open to help. But I would like one of the residents, I don't know who could talk a little bit about the resident mentoring. But yeah, I don't know.
Yeah.
Oh,
sorry.
Sure. Yeah. Go ahead.
Yeah. So, like, I think, actually Stephanie's on the call. She's my resident mentee. So it is very informal. When I found out that I was her mentor, I kind of just like sent her a message and let her know, like, if she needs anything, you know, I'm always there to talk or like give advice and things like that. And she has taken me up on it at least once. So yeah, and Stephanie, I am here if you need me. So yeah, it's just, you know, and I plan to, like, every kind of couple months or so, I try to like check in on Stephanie, and I'm also a mentor for one of the TYs, and just to kind of see how things are going. So yeah, just sort of informal.
I'd like you to be my mentor, Alexandra. She's so warm and cheerful. I would love that. But yeah, Alex?
And it's also kind of like the same thing for us too. It's kind of like informal. You have a mentor, but you can ask anybody. You can ask any senior, anybody about questions. It doesn't have to be, like, for example, Stephanie with Alexander. It doesn't have to be them. I've been helping Stephanie since we did like 2 weeks of nights, and you know, at the end of it, I'm like, do whatever you want. Like, you can ask me whatever you want. You can text me whenever you need me to. Don't be scared to do that. And I told her, if it's 3 a.m, I mean, I'll wake up. I'll answer your question. But if you really need to, text me. Like, it doesn't have to be your specific mentor.
Right.
We are all the second years and third years. We're all mentoring everybody here.
Yes, and I think really we set up the official one just so that the minute someone came in the door, they would know someone that they could call. But yeah, you're right. We didn't expect that you would have to just be matched up with that person, but because we know that it evolves, but it's just kind of nice from the moment you get there, in case you have a question like, what should I wear to the banquet, you know, or whatever, you know, the resident within a week or two of work, you know who to ask. Now, geriatrics, that's another. As you get older, geriatrics becomes very dear to your heart. You know, my mother is 91, and you know, I really try to, you know, teach on geriatrics whenever we can. We have the residents do a geriatrics month. On that month, they do various experiences. Has anybody on the call done geriatrics yet? Have you done it, Alex? Can you tell them about it?
You mean like palliative and geriatrics? Yeah,
tell a little bit about that experience.
So you basically do a month of like palliative / geriatrics. What you do is you kind of switch between the office or the inpatient palliative team. So you actually go to them for one, like they switch it from 1 week to the other. So 1 week you'll be in the palliative team inpatient. So you go with them, you go with them, you follow, there's a bunch of consults that you do, and you go one-on-one with the palliative attending during that week as well. And then the next week you switch to like more of an outpatient palliative team. So you see the patients that are kind of outpatient. They're seeing the palliative specialty as well.
And I think the other thing is the residents make house calls, home visits. I was just in the Williamsburg office, and we made a home visit on an elderly person that lived in a house just a block down. We, at the time, right now, are we doing nursing home visits? That always comes and goes. I don't know if we're going to a nursing home actively. COVID kind of screwed that up.
And not right now, because I just finished my geriatrics month and we didn't have nursing home time.
Yeah, the COVID thing kind of, when people couldn't go into the nursing home, that kind of messed that up. But then in geriatrics, we have 6 resident presentations on geriatric topics. And of course, I try to balance out that palliative part because I know it's geriatrics is more than end of life. So we try to, in the office, always be, we have our own PharmD, who's wonderful, Dr. Michael Geishauser, which everybody on the call could say, yay, Michael, we all love him. But Michael is really good at helping us with people at polypharmacy and how to, you know, make med lists better and decrease use and adjust things. We adjust things for renal dosing all the time for the elderly. He helps us do that. So we really are on top of that. So those are some of the geriatric experiences. Well, we're coming down to the last 3 minutes, and the way to have a good meeting is end on time or early. That's the only way to have a successful meeting. So I am going to tell you that I hope to see all of you at Family Medicine Educational Consortium. If I don't see you there, feel free to reach out. If you go to our website, which is Altoona, what is it, www.altoonafp.org or something very simple like that. You can email any of us. I might figure a way to put the emails in the chat. I don't know. I don't know how to do that really. Could somebody, one of us, Dr. Kadia, could you throw a few emails in the chat, like my email and your email?
Yeah, I can do that. Dr. Singh, I don't know if we have time Sandra had a question. I don't know if
we do have a time. We do.
Okay.
We can answer things. What's the next question? Sandra, go.
Sorry, it might be a longer answer, but I just wanted to ask a little bit about how the curriculum is. From what it seems, is it block curriculum for
Sandra, which curriculum?
How the curriculum is structured, especially for intern year.
Oh yes, curriculum. Okay. If you go on our website, you'll see our rotation schedule, and people have, okay guys, see how good I can do this. Is it 3 months of medicine, 2 months of OB, a month of ER, a month of surgery, community medicine, what am I missing?
Peds.
Yeah.
2 months of peds. Did I get everything?
Did you get OB?
I did OB and I did community medicine surgery. So that's the rotations. But I think when you think about our curriculum, I run our didactics. We'll be happy to have you look at any of that. We try to every month have a lecture. We have an endocrine clinic with a very good teacher in our office. And Dr. Humphrey gives a lecture every month. We have cardiologists that work with us and they give a lecture every month. And I try to balance those didactics out so we have something kind of in the broad spectrum of family medicine every day. I think the didactics the residents are pretty happy with, at least that's what they tell me when I send them anonymous surveys. I haven't gotten complaints, but people really like that. Now, so by curriculum, did you mean rotation schedule or what did you mean?
I did, yeah, I did mean rotation.
Okay, Dr. Kadia is going to put our website in the chat for me too. And if you look there, you can see everything about, you know, rotations. And then the OMT curriculum, we have OMT clinics, we have OMT workshops every month for an hour and a half, which is all hands-on. We try to get away from those slideshows and more to the tables, and we teach MDs and DOs. Does that answer your question, Sandra?
Yes.
Okay, good. Well, take a look at the website, everybody. If you throw your emails in the chat, I would like to send you out a little discovery box from Altoona Family Physicians. So if you just throw them in the chat, unless Scott, would I have their email addresses on that spreadsheet?
Yeah, we did. Everyone who registered for this, we sent their emails to you, so you've got that.
Well, I'm not giving them all a discovery box. The people that came, I'm writing down names really quick. Can you write them down, Kiati? And I just am jotting down people's names because I don't forget anybody. Sandra.
So Scott actually emailed or put on our website. So thank you, Scott, for doing that. And then Dr. Maurer, Dr. Spiru, they also added their emails. I will get all of your guys' names.
Thank you. Thank you, Dr. Kadia, because I tried to do it, but it's probably illegible. And
I can help with that.
And oh, good, because if there's two Maries, I'll screw up. And I don't want the wrong Marie to get the discovery box because
Scott, will you be able to email them to me?
Yeah, I can let you know who all is on tonight.
There's all kinds of treats in there. There's all kinds of treats. So I want to make sure everybody gets treats. Well, I want to thank my residents and faculty for getting on the call. Thank you, Dr. Kadia. Thank you, Alexandra. Dr. Spru. Thank you, Dr. Maurer. Thank you, Dr. Huxbury. Thank you, Dr. Nowicki. I'm glad to have a guy on that Women in Medicine call. And thank you, Raphael, for coming as a guy, support those women in medicine. And thank you, Alex, Alexa, Raphael, Yami, Sandra, Amanda, everybody, and Marie. We really appreciate taking the time to get to know our program. Look at the website, come meet us at Family Medicine Educational Consortium, and everybody have a wonderful evening.
Good night, guys.
Good night. Thank you, Scott.
Good night.
Thank you so much, Scott.
Thank you. Good night.